Hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment, and you can see you've got some areas on the tibial plateau where you've lost some cartilage. We're trying to smooth these areas out. Then as you look up at the femoral condyle, you can see a similar, almost like a kissing lesion here where these two areas touch. And so that is why we had that discussion about orthobiologics and about trying to control your symptoms short of a knee replacement or more invasive surgery. So right now we're just taking care of that area on the femoral condyle where the cartilage is a little bit loose. I think that's pretty good. I'm going to look in the back of the knee next, but so far the meniscus itself looks pretty good in the front. Okay, so now this is the posterior horn of the medial meniscus, and this looks pretty good. So that's a plus. It looks like the big story on the medial side is going to be this arthritis that you see on the femoral condyle above and the little divot you see in the tibial plateau. We'll look in the intercondylar notch. This is where the anterior cruciate ligament lives. And we can see your ACL runs up right here. A little bit frayed, but it's still there. And then in just a minute here, we'll look in the lateral compartment. And as we look here, we can see some similar loss of cartilage in the lateral compartment. So this procedure that we're doing with the shaver is really called a chondroplasty. This lateral meniscus looks like it's in a little worse shape than the medial side. You can see how some of this tissue is pretty friable, pretty wispy, and comes to the shaver with a little bit of suction. This is where we were very suspicious that you had a more unstable tear. And I think we're just seeing it right there. I'm going to turn off the suction so we don't fool ourselves. Yeah, this is where the tear was right here. This is the split in the lateral meniscus right there. So I'm going to take a pair of biters and just trim that out a little bit. Okay, so we're all done in the lateral compartment. We had to take out some of that meniscus tear because it was not stable at all and was not torn in a place where we could even put a suture in it. And so the remainder of the compartment, we've been trying to work on smoothing it out. But obviously you've got some arthritic change here that's going to potentially cause symptoms in the future that we'll have to manage with you. As we look up at the patellofemoral joint, it's kind of the last area of the knee we check. Hand me the shaver, please. We see the story is pretty much the same here as well. In that you've lost a significant amount of cartilage in the trochlea here. And you've got some arthritis underneath the patella too. So we're going to keep working here. We'll show you some more in a little bit. But I think this will be the end of the video. We don't really have much more surgery to do. If there's anything else we do significant that's different, we'll come back up on the video. But otherwise, good luck to you now. Bye-bye.